My name is Buffy Cooper, and I work as a clinical nurse specialist at the IWK in Halifax. And for the last 4 years, I've facilitated groups doing an interprofessional module, generally in the winter term. And the module runs for about 6 weeks. I got involved because one of our pharmacists invited me to be a facilitator, knew I had a background in education. And so because I really like a challenge, I thought, oh, I'll do that. So I did. I really had no expectation, I don't think, of what it would be like. I just thought it might be kind of interesting. And I think looking back on the 4 years, one of the things that there's been a couple of things that have stood out for me. One is the pleasure of meeting students from different backgrounds and different disciplines. Because I have a nursing background, I do tend to meet nurses when they come to the unit where I work. But I really have very little opportunity to meet students from medical lab, from physio. So that part has really been exciting and interesting, and also challenging, because it makes you put aside your own discipline and things that I knew about nursing and think about what interprofessional practice is and what that would look like with that group of students. So that has stood out for me. I think the other thing that has stood out for me is really the fact that the students come together so quickly. When they come in that first day and meet each other, is very obvious. Rarely have they known each other before. And yet, in a periods of 6 weeks, a process happens that brings them to a place where they're able to collaborate and work together on a project and produce either a paper or a presentation. This year our students did some work for our website together. So there's been all kinds of interesting things that they've done, but they really get beyond being the pharmacy student or the physio student and really come together around, as interprofessionals and interprofessionals in a team, how do we work together? So I think even in a short period of 6 weeks, that has really been fascinating to me, because I think I came to it thinking that that wouldn't happen. I really had no idea that that would happen. And I've come back and done it every year, because really and truly it's so much fun. It's really not a huge amount of work. It really teaches me things. I have an opportunity to meet often students who come back as professionals, who when they've qualified come back to the hospital and work. And I just feel the benefits of it have far outweighed any energy or any work that I've had to do. Has been minimal compared to the amount that I've gotten out of it. And lastly, I would say each year I've facilitated with one of our staff members from the IWK, but again, I've done it with someone from a different discipline than nursing. The first year I did it with pharmacy. I've facilitated with occupational therapists, with physiotherapists. And again, it gives you an opportunity, I think, as a nurse, to work in a professional way that's different than what I do every day with those professions. So you come together, I think, and work together in a different way than you would if you're working in your clinical setting. So all of those things have really been why I've done the interprofessional work and why I certainly would do it again.